Good morning to Miss Pang and my fellow coursemate. Today, our topic is about impulse control disorder, which is also referred as ICD. Our group members are Kylie, Hannah, Marcella, Charwei, and lastly Krista. So, what is ICD? An individual that has ICD is unable to control their wants or urges and has a hard time resisting actions to hurt themselves.
An ICD person will first start to have an impulse, growing tension, temporary pleasure, relief, and feel guilty after what they did. The symptoms of ICD are categorized into 4 types: behavioral, physical, cognitive, and psychosocial. Behavioral symptoms include aggression, stealing, playing with fire, and having a constant tingling sensation. Physical symptoms include burns on the skin of children, and adolescents who experiment or play with fire, and can also cause sudden exhaustion. Cognitive symptoms present are agitation, irritability, lack of patience, difficulty concentrating, obsessive and intrusive thoughts, and also the build-up of pressure inside one's head and chest. While psychosocial symptoms include low self-esteem, social isolation, deflated mood, depression, and also anxiety. The severity of ICD is measured on a scale of 0 to 4, in which explains the number of times per week the individual carries out the act. It's also due to how much they are able to control their urges according to the scale.
The causes of ICD are genetic, environmental, and physical. In genetic factor, children who have family members that suffer from mental disorder have a higher chance of developing ICD than others. For environmental factor, professionals believe that children who have grown up in families where explosive behaviors, violence, and verbal abuse are more likely to develop ICD. In physical factors, an individual may have ICD through a physical experience which will lead to the damage of the neurochemical in their brain which control their impulses. This may lead to ICD. The individual may also be exposed to physical, mental, and sexual abuse during an early age and will exhibit this trait as they mature. Some factors are also due to the absence of a father or a mother figure. ICD exists in many forms. Some of them are known as intermittent explosive disorder, which is known as IED, pyromania, kleptomania, and gambling disorder. One of the most common forms is intermittent explosive disorder. It is when someone is unable to control their anger and will act upon reflexivity. Their thoughts are inhibited in the situation, and they will find this lack of controlling distressing.
Pyromania also exists as a form of ICD. Pyromaniacs often have the impulse to set fires to induce euphoria and often obsess on institutions of fire control like fire stations and firefighters. They purposely set fires on more than one occasion, and before the act of lighting the fire, the person usually experiences tension. When around fires, they gain intense interest and may also experience temporary pleasure, gratification, and relief. Moving on to kleptomania, it is a disorder that shows when an individual repeatedly gives in the impulse to steal for no great gain. They find happiness in stealing, and often the things that they steal may not even be useful to them. An ICD person will also have the impulse to gamble without thinking of all the consequences. They find it difficult to stop or slow down the activity of gambling, as this is known as gambling disorder. It is treatable by counseling, self-help, or medication.
The long-term effects that result when the symptoms of impulse control disorders go untreated can be extremely detrimental and long-lasting. It may result in decline of academic performances, suspension from school, participating in self-harming behavior, and more in an individual. It can also cause the development of another mental illness such as substance abuse, addiction, and so on. The individual is also unable to form relationships with others and lose their jobs, which can instill depression, and the individual will feel directionless in life. The psychosocial approach to the treatment of ICDs includes taking medications, systematic desensitization, relaxation training, stimulus control, and others. Before we end our presentation, we urge anyone who is suffering from this disease to do not make a permanent decision based on your temporary emotion. The end. Special thanks to our lecturer Ms. Bang and everyone.